Okay, world. Now I'm going to introduce myself, Dr. Stephen Frost of America's Got Talent, and also the owner of Frost Laboratories Incorporated, 308 West State Street, Suite 460, who's now going to tell you how we're going to cure cancer in 3 years. But before we do that, we have to introduce my cast of character, meaning myself, because that looks like I'm the only person doing research here, which is funny because I can do it all on my own. I actually don't need any help. That's funny. And I'm going to cure cancer all by myself with all my $100,000. That'll be funny because it'll be work and it will work. So that's what I know because it's that simple. So remember, I have the right to write contracts. So this is an example of employment. This is an employment contract because I'm the president. I can do that. And this is the one that indicates that I separate my business from pleasure, which Gloria, for some reason, couldn't figure out. Oh no, it's Gloria Frost, the evil one, the first evil one that didn't like cancer. Okay, Angelina Jolie, remember, it's Gloria Frost one that interfered with the development of this cancer research. So she's the one that's responsible for your 2 breasts being removed. The evil Frost, Gloria, not Steve, who's nicey nice. See, she made me look evil, and when I was nice, she's not nice. Oh my God, there it is, my signature and everything, because I'm evil. So it just proves I separated business from pleasure by using the American Express card. Don't leave home without it, because that's how you separate business from pleasure in America. Of course, there's all sorts of fun things in this book, including stock. Oh my God, I used to have something called stock in that company, but now I have stock in my own company. 100% I think in my own now. So, oh no, this is like the certification of my insurance that I still have to get because I'm like running around the chicken with my head cut off. But right now I have very little insurance needs because I have very little worry, but I have to get it for my stupid suite, which I'm having. 308 West State Street, 460 Suite in Rockford, Illinois. Come on out if you ever see this video. Oh no, this is called the incorporation papers. That's the old school one. There it is right there. It shows what it, that I actually did it. No, he does like, law because he can do it at home because that's what he can do. He used to teach biology at American Intercontinental University. He got an award for that. Oh my God, he has a printer, like a backup printer. He has a friend that like scorched earth. He didn't believe in blowing up the world. And then I had an employee manual so they could actually, have employees. But right now I don't need any because I'm the one doing it all by myself. So remember all those guys out there, I'm not only doing my own comedy, I'm actually doing all of my research at the same time because it's that simple. And of course, because you got to remember, science is also politics because you have to raise funds from the government, but not in this case. Oh my God, it's Winston Churchill. He loves scotch. Winston Churchill. Well, that's the way it is. England must stand together against the evil Hitler. Oh, that's true. And this is one of his books. Winston Churchill. It's one of the originals because it's called a book for those that can't read. There it is, 1906. That's the original date. Evil. Because he loves Winston Churchill because he visited his museum in London, England. Dun, 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 dun. London is in England, by the way. It's a nice place. And then it has a book because it has like indices and stuff like that. And then there's another book of history that I lived in Galveston Island because that's where I did my dissertation or my PhD work. And there it is, it's Isaac Storm. It listed the first ever hurricane that entered the Gulf of Mexico. Surprise, bam, 6,000 to 8,000 people dead in the area. And you know what? They rebuilt pretty quickly, unlike today. So they were able to survive the storm, but that was the first major hurricane, and that happened in 1900, well before the Industrial Revolution. So therefore, it's the heating of the sun, probably with the CO2, but really the heating of the sun started back then. So therefore, it's not just CO2 alone, but it is the sun that's causing it. As the eclipse showed, if the sun isn't there, you get drop of 10 degrees almost instantly because the sun heats the earth. The stronger the sun's rays, the stronger the temperature, the higher the temperature, and we have been doing this for only like gazillions of years on Earth. If you actually believe in the Earth being 4 billion years old, you don't have to. You can believe in 10,000, but the Earth still changes, and that's just the way it is. All right, so this is how it works. As I said, now I'm going to reveal my secret. It's called peptides, which are naturally occurring in your blood. I'm going to take special peptides from different cancer proteins in breast cancer and prostate cancer. And I'm going to chop them up in a special way that only I know. And then after I get those particular chopped up pieces from New England Peptide or another company that will synthesize those or make them for me, then what will happen is I will then modify them, or the company will modify them to create a vaccine to stimulate your immune system. These will then be injected into patients that have the active disease at different stages. So for example, breast cancer stage 1, 2, 3, and 4. What will happen is we'll see how effective these peptide matches are at the different stages. What I'll do is I'll do a huge mix of different peptides in the beginning, and then maybe we'll settle it down and try to home it in. But they're so inexpensive that we can do that in the beginning. If there's no effect, then what I'll do is rearrange the peptides and try again. It will not cause any harm to your body because the peptides themselves are naturally occurring in your blood. Therefore, all I need is a stabilization agent, which would be a conjugate, is what we call it, to attach to the peptides to help them stay afloat. What you then do is you inject at a particular level of time, meaning every day or every 6 hours, as monitored by whatever means I see fit. That's not up to the general population to understand. Then what happens is we continually inject these at a certain rate, and then what we do is we monitor the progress of the tumor. If the tumor doesn't change, then that's fine. If the tumor does change, then that's it. It is better to treat patients that are resistant to any existing drug treatment plans. So if the patient is having difficulty with any kind of natural or the current acceptable treatments, those would be the best ones to select for this treatment. I do not want to interfere with the natural progression of the disease treatments. So let's say that you have a certain pattern that your doctor has said. If you finish the pattern and it's not working, then you go to the emergency room and then you get the special treatment. This is called a selection process. You do not want to interfere with the best treatments that exist today. What you want to do is supplement them in the beginning. Once it's found that to work on the resistant population, then you go to the next stage, which would then go to other treatment options. So what I want to prove first is whether it works in the hardest cases. If it really doesn't work in the hardest cases, then the treatment is worthless. See, if I can't treat the hardest cases, then the treatment is worthless and it needs to be removed or redesigned. That's simple if you know what you're doing in clinical trial work. Therefore, I only need a few patients, not a ton. So what happens, because I'm selecting for a certain group, I don't need 100,000 of them. What I need is maybe 10 or 20. If I cannot cure 1 or 2 out of the 10 or 20, then my program is worthless and it needs to be scrapped, and that's it, meaning I don't need a whole lot of money to do that, meaning I should be able to do it on my own, because I don't need much money. Most likely, if people hear this, they'll find out that this is a good plan. Most people that have cancer at a stage that is not treatable will take the risk and take the clinical trial. The clinical trial is an easy one. If we just monitor for about a month or 2, we'll find out if it's working. Since there is no harm, since it's a peptide and its safety is already proven using BNP and other peptides that are naturally existing, therefore there's a low risk of it because it's a natural one that's already found in your blood system. In my opinion, the safety one should be waived in this case, and if that's the case, that would mean in probably a year we could have experimental results. That's how easy this is, because I've only studied it for 30 years. It has already worked in rat, so therefore that was shown in GBX Summit. So all I need to do is actually find a little bit of time in order to do this work. I know exactly where to go for the proteins. I know exactly how to cut them up. It just takes time to sit down on a desk to do it. It'll probably take me about a month to set up the way I want to do this with the peptides. It will cost less than $100,000 in order to create the first set of vaccines. The only thing that I have to do is to show sterility, and that's going to be the more difficult part. So I'm going to have a laboratory of some kind, and I'm hoping that there may be a company like Thermo Fisher or someone else that has a small room where I could go set aside and try to prepare these things in a sterile environment. It doesn't take a lot of sterility. It takes a little dinky room with a filter, and that's about it, because it's going to be that small of a trial. On a big trial, then you need to scale up a little bit. So please, I already know what I'm doing. So it's not going to be much. If it works in that, it'll be fine. At the same time, we'll be creating the one for prostate cancer. Now, if I get a couple of $1 million, it'll help in terms of getting my own facility started and running up, so my sterility can be under my control. Without that, I can still leverage or consult with other people to try to do it, because it's that easy. So I've already done all the work. So this is cake for me. For you guys, it seems to be like impossible. For me, I already planned it out for years. So that's it. It's that simple. In 10 minutes time, it's that simple. Okay? In cancer cells, they produce bad proteins, not good ones. The existing immunoassays detect good ones, not the bad ones. The bad ones are now chewed up and are detected by mass spectrometry. We had seen these bad ones in something called a mass spectrometer already. Therefore, all I have to do is take those particular bad proteins and then make peptides out of them. Since I already know what they are, all I have to do then is chop them up, put on a conjugate, which I get from then, and create a vaccine. If the vaccine works, voila. If it doesn't, who cares? Because you probably won't even have to pay a dime. Meaning, I'm taking all the risk. So if it works, then I get all the money for the vaccine. So really, I think that's a good deal, Steve. Gee, I spend maybe 30,000 of my money, and if it works, I get like 100 billion. Let me see, is that a good investment? 330,000 versus 100 billion. Yeah, I think it's a good risk. So that's a pretty good rate of return. So that's why I'm doing it, because I think that the rate of return is pretty good. I mean, I lost 100,000. I mean, I hope I don't have to lose another 100,000. I mean, it's just an irritating thing, but really, I think a 25 mil would be easy to do if you actually know that this is real. Because if you look at GBX Summit data, it's already been shown to work in rat. I never take a risk that I can't complete. So there's a 99% chance this is going to work. If I should be able to do it. If it doesn't work the first time, then I'll just redo the formulations. So please, just don't worry about this. Hopefully within a year or two, we'll actually have the data. So again, I never ever hurt an existing pattern of treatment. So the goal is not to replace the existing patterns, but to first show that it works on the hardest cases. If you can't make the hardest cases work, then you might as well not do the easy ones. So therefore, I want it to work on the hardest cases first, meaning the ones that are resistant to treatment, and they're probably the worst case ones in stage 3 and 4. And if I can't get that to work, then I don't want to use it, because then it's worthless, and then I'll move on to some other cancers, or do whatever I want, like play a game or whatever, because I have enough money to do this and still have fun. So I love America. I greatly appreciate all the things they've done in the world. I hope that these cancer vaccines work, and I hope these stupid people will actually get over themselves and say, you know, it's really good that Steve is here. I mean, if he only makes $1 billion of some kind, he would only use it in Rockford. But really, Judge, you're like the dumbest judge ever. Really, I can't wait. It's like in history books, it's going to go down. Colleen McGlory turned down Dr. Stephen Frost, a billionaire, and he has no wife, meaning Gloria and Colleen could have been a billionaire's wife, but no, better get Mako. At least Colleen doesn't have any money yet, but at least Gloria Frost got a couple mil out of it ahead of time. So I'm just happy no matter what happens. If you're happy and you know it, you're a doctor of science because you've been doing it for tons of years and you've been retired since you're 45. And you've had a party every day since that time, but people just don't know it because you're having a good time. You can't have a good time in America. It's not allowed. No, is it? I'm financially free. My daddy taught me that. My dad was a CPA, and he goes, Steve, be financially free and never report to anyone. You be your own boss, and then you tell everybody what to do. That's the real power in America, being the president of a corporation, even a small business that's only made $400,000 or so at Biomarker Insights Incorporated, which has already demonstrated that my software for diagnostics, which I haven't even touched, is also good too. Oh no, maybe they don't even need the diagnostics if the vaccine works. That would be true. Then why would we need the diagnostics? Oh my God, what do you mean, Dr. Frost? Well, if these vaccines work, then you don't need to diagnose the cancer anymore. Oh no, I put myself out of a job? No. Uh-huh. Dang nabbit, I fired myself. Evil. I fired myself. I have to cut my diagnostic program down. Damn it, Jim. I actually had to fire my diagnostic team. Me. Now I have to do the vaccines instead. Evil. He's evil. He cut his own corporation down. Hey, I was going to make all that money on Biomarker Insights Incorporated software. You still can't, Steve, because there's still other diseases that haven't been discovered yet on planets named Dog. What do you mean? Yes, we can use the Biomarker Insights software on cats and dogs. I mean, we're advancing on humans. Well, we should be able to do it on cats and dogs too. You mean veterinary medicines? Uh-huh. We can start doing diagnostics on veterinary medicines to identify the biomarkers for cancer for dogs and cats. Hey, that sounds like a great idea. That will be more money then. We can have more money. I just can't keep counting. I mean, I give it all away. I mean, I have a couple billion here, a couple billion there, here a billion, there a billion, everywhere a billion. Old MacDonald had a bank. Oh well, it's still a dream, but really it's only like maybe 2 or 3 years away now. So please, Angelina Jolie, everyone out there that has breast cancer and prostate cancer, cross your legs and breasts. And please don't do any self-mutilation for a while. Give me at least 3 years to show how this is advancing. I mean, every day I can give an update on my handheld. Really, it's that easy. Oh my God. Today, I have to go. I mean, I wanted to take a walk, but now I'm going to have to figure out what to do. I got to take a walk. I'm so stressed out from not doing much other than trying to get my house packed up. Evil. He's evil.